Hello and welcome to Eyes on Research, the podcast that digests the latest scientific innovations in eye research using simple and understandable terms. I am your host, Thales Guimaraes, medical doctor and clinician scientist at Moorfields Eye Hospital. Hello and welcome to another episode of Eyes on Research. It's been 3 months since the last episode was released. And well, I do have a justification for that. But long story short, I got a viral infection in January, a viral bronchitis, and it took quite a toll on me, and the recovery was quite slow. And this was followed straight after by the arrival of our child number two, which was indeed a blessing, but things have been busy, as you can imagine. But I'm happy to say that we are back full time with a very nice schedule of weekly episodes released every Wednesday. I'll post the schedule soon on our Buy Me a Coffee website, so keep posted. The link is on the description, and you'll be able to follow us closely. But let's cut to the chase, yeah? I'm very happy to have you here listening to this episode because this is a very special one. It's a very, very special episode to come back to. Not only because we had 2 sunny days in a row in London, which is almost unheard, but also because this is a big topic. We'll be talking about the most common cause of severe visual loss amongst people that are 50 years and older. Age-related macular degeneration. We'll be defining it first and then, let's walk through its causes and the current avenues of treatment. Age-related macular degeneration, in short AMD, and we'll be using AMD as an abbreviation throughout the episode to make things a little bit easier, is, as the name suggests, a disease associated with aging, right? And it's a macular degeneration because it affects the central section of the retina, a region that we call macula. Remember that for us to see, light comes inside our eyes and goes through the entire media of the eye, reaching this film-like tissue that we have in the back of our eyes named retina. The retina is composed of light-sensitive cells which respond to the photons of light that comes inside our eyes. And this triggers a cascade of events that end up with the information being sent to the brain via electrical impulses, right? And then the brain is the one that's responsible to interpret this as an image, right? The macula is the very central part of the retina, which is the region that's richest in a type of light-sensitive cells named cones, right? This same central section of the eye is responsible for central vision, vision of detail, fixation, color vision. So most of what we see comes from our perception of the photons of light in the central section of the retina. So that means that only the central part of our vision is affected in this disease, and the peripheral vision or the side vision is usually normal throughout life. So patients don't typically have difficulties, for example, with things like tripping over objects or bumping into walls or people in the street. But patients, they do lose the ability to see faces, to drive, to read smaller prints. So like fine details, right? Fine things like that. That's what patients lose most. This follows a natural history, right? Of course, it's not sudden in most cases at least. But it starts by affecting the very middle section of the vision, the very central section of the vision, not the edges. And usually you get these on both eyes, but there's also cases where you can get this in one, but that's very rare. And usually there's a little bit of asymmetry between eyes, meaning that you may have one eye that sees better than the other, right? This is the nature of AMD. But with time, it gets blurry and distorted, and you may actually struggle to see anything in the middle of your vision in both of your eyes. It's not a painful disease, right? So it doesn't cause pain or any other symptoms like that. And it does not affect the appearance of your eyes, right? So how people see your eyes, it doesn't cause redness or anything like that. Amongst the most common symptoms, indeed, are seeing things distorted or some lines wavy, right? These are the main symptoms and kind of like what AMD is. But what causes AMD, right? Because we need to make sense of this. So let me just start by saying that because of the commonality of this disease, remember it's the most common cause of severe vision loss in the elderly. It's one of the most researched diseases in the eye, right? Because of its commonality. So we know a lot about it. Most of the things that we know for age-related macular degeneration comes from very, very long studies with many patients, right? So we can be quite secure of a few things. First of which is like the risk factors that may put you under a higher risk of having the disease, right? So amongst the main risk factors that we have identified are, for example, a diet high in saturated fats, right? So you get foods like butter, cheese, meat. These are foods with high saturated fats. Being overweight is also another risk factor, and also smoking cigarettes. Having hypertension, which is high blood pressure, and having a family history of this disease, so someone in your family that also had age-related macular degeneration, is another one of the risk factors, which is highly associated with someone developing the disease. Other risk factors that have been identified in some studies are heart disease and having a high cholesterol level. And there's also evidence to suggest that, frequent exposure to UV light coming from the sunlight is also a risk factor to develop age-related macular degeneration. And hence, we suggest our patients in general, to be honest, not only the ones who have constant exposure to sunlight, but everyone out there, to wear sunglasses when you are out and about. And I'll also say, in case you haven't listen to our episode on the types of damage that the sun can cause to your eyes, do check it out. It's relevant, and I think it's very important to know those things. However, the most common risk factor is age, right? Remember the name, age-related macular degeneration. And increasing age, for that matter, is the most important risk factor. So you see the issue that we have here, right? Because guess what? We will all age. All of us are going to age. So the most important risk factor we can't really control, unless someone finds a way to avoid getting old. But we are still far away from that. It's important to say that, and I think this is very important to stratify the disease. There's actually a classification that we use. We tend to group patients into two different subgroups. And this is important because these subgroups, they have a very distinct disease, right? And things to expect. They go in a different way, a different natural history altogether, right? The two types are either the dry form or the wet form. Let's talk about everything separated from now on, okay? So the first thing that we are going to consider here is the group that we name dry AMD. So these are the patients that get the most common form of disease, right? And in most studies, most long-term studies, in multicentric cohorts, right, with different ethnic backgrounds, they say it's around 70 to 80% of cases they get the dry form of AMD. It's a multifactorial disease, right, with a myriad of risk factors and causes that's it's very specific. They're not very specific, and we call it multifactorial because not only there are some unspecific environmental factors involved, but there's also some genetic influences to it, right? This is a disease that has a very slow degeneration that happens with time. And one of the main features of it, clinically speaking, is the presence of small yellowish deposits on the back of your eye below the skin of the retina that we call drusen. You may have heard of this term if you or a relative have AMD. So I think it's important to say what drusen is, right? So drusen, as in drusen, are deposits, right, of proteins, lipids, and the debris of cells, which appear within the layers of the retina, and they evolve, right? They enlarge, they coalesce with other drusens, with other deposits. So essentially, they become bigger and bigger, and this causes long-term damage. At the late stage of this dry AMD, you get something that we call geographic atrophy, which is essentially, as the name suggests, it's a large area of cellular loss. You can maybe trace a parallel and consider this to be a scar, right? So it's a scar of the retina tissue, right? That's the late stage of dry AMD. Historically, the only form of treatment that we had for the dry form of AMD was a complement. It's a tablet that people used to take named Aretis, right? And this study, it was arguably the most important study for the disease for AMD, right? And it was a large study. They even changed the formula with time in the second part of this study. In this research, they found that people with some forms of drusen may have a protection with Aretis, and it may slow down the progression of dry AMD, right? By taking those vitamins. Aretis, as in AREDS, was essentially a multivitamin thing, which was very specific in its quantities, and that was the only thing that we could do for dry AMD. But right now, we actually have something else that can be done for the late form of dry AMD, the one with the geographic atrophy that we have just discussed. So we live, very, very nice times, very promising times, and very exciting times, right? Not only as doctors, but also to our patients. We think this is, we are living in a time where we actually will begin to see treatments for diseases that, were largely thought to be untreatable. These two medications that have just been approved are Avancicaptad Pegol, which has a commercial name of Izervay, and Pegcetacoplan. The commercial name is Syfovre. Both of which are injected in this jelly-like tissue that we have in the middle of our eyes. The name of this is vitreous, right? So if you very gently press down your eyes, you feel that there's a jelly inside your eyes. And this is the vitreous. So it's an injection within this part of the eye. These medications just got marketing approval though, so the very, very long-term effects of these medications is not completely understood. But so far it seems to provide slowing of the disease progression, right? In the cases of geographic atrophy, in the cases of this scar that keeps enlarging. So, it's indeed very nice that we finally have the option to give something to the patients, right? Not everyone will be a candidate again, right? Remember that this is a specific treatment for the late phase of dry AMD, the patients that actually have geographic atrophy. One thing though that, I forgot to say, and I think it's important, and this is something that we advise generally every patient that comes to us, and not only the ones affected, but also family members of affected patients with AMD, right? So we tell them to eat yellow fruits, vegetables, dark green leaves, right, and fish, and generally having a healthy and well-balanced diet. And we suggest this type of foods because there have been some studies showing that this may be beneficial for patients with AMD. So this is another advice that patients can follow. This is the dry form of AMD, right? So what about the wet form of AMD? The second group of patients that we call the wet AMD. Now, this form of the disease is more serious, I would say, in a lot of ways, but it's less common, right? There's a very effective way to treat this form, so it's very important to go immediately to the ophthalmologist, right? When patients suddenly realize that their vision is blurry or that there's wavy lines on their vision that appear out of the blue, they should trigger patients immediately to go to their ophthalmologist. Wet AMD is when new blood vessels grow under the retina, right? And these are very thin vessels, right? So, they may burst, they may leak. And if this is not treated when it happens, it may lead to scarring of the retina. And, we have a medication that modified the history of this form of age-related macular degeneration. These group of drugs are called anti-angiogenics. And again, these are given in the same way that those two new dry AMD treatments are. So in this jelly that we have inside the eyes, right? These drugs, these injections, they act by reducing the function of a factor that's highly associated with the formation of new vessels, named vascular endothelial growth factor, in short, VEGF. So we call these anti-VEGF drugs. But these group of medication essentially change the prognosis of this disease because we can actually treat it now and very effectively, so long as the wet form is diagnosed and treated rapidly. Some patients may also have lasers, right, to treat some types of wet degeneration. And we do that to focus the laser light beam on the abnormal vessels. And it helps to shrink it, to destroy it, and this slows the leaking process. There's also something else which is important to point, and it just crossed my mind, which we ask some patients due to the progression, in terms of vision loss. There are some rehabilitation programs and low vision devices that can be used to enhance some visual skills and help patients read better, adjust better with living with the disease, and gives them a little bit more of independence. So I think, to the patients who are losing their vision and, even with the injections, there's still progression of the disease. Remember that there are technology devices that may help. So where do we stand research-wise, right? The name of this podcast is Eyes on Research, right? That's what I want to know. So let's get there now, right? As I said, AMD is the most common disease to cause severe visual loss in people above 50 years of age. So lots of research studies are currently ongoing, many of which we are very excited and looking forward to having final results. Remember that we are using injections for the wet form of the disease, which may need to be repeated lifelong sometimes in a quite intensive way, right? So we have plenty of good medications to do just that. Now imagine having the possibility of treating this form of the disease in one and done manner, right? So you go there, you have some sort of treatment, it's either surgery or an injection, and that's it. Well, that's where we think the future is going. That's what we think the future holds with technologies such as gene therapy. And by the way, we have a very long episode. It clarifies a lot of points about gene therapy. So it's one of our previous episodes. I highly recommend you checking that out because it certainly shows you where we are going to, right? But the new treatments that we're talking about are not only for the wet form, right, but also for the dry form. And there have been many, many different clinical trials testing different things, again, from gene therapy all the way to lasers, to oral medications, oral supplementations, right? So we as eye doctors have a cautious optimism that some of these treatments will be approved in the near future. hopefully increasing the number of families that we can treat and the options that we can offer to them. And in the end, we all want a personalized treatment, right? To give them as much of a personalized treatment as we can. I think it's safe to say that the future is looking as bright as it has ever been for this disease, and that we are about to witness a big change in our understanding of the disease, and also with the presence of new, available, and approved treatments. But as I usually tell my patients, medical research is a marathon instead of a short sprint, but we do hope to get there very soon. Thank you very much for listening to me today. I hope you enjoyed and you learned something new, and I hope you have a great rest of your week. I should also say that, we have social media accounts where we post very short videos about teams just like this, but teams that did not go on to become a full episode. So please do visit us on @EyesOnResearch on your favorite social media, Twitter, TikTok, Instagram. We have it all. Also, you'll find the link in the description of this episode and of all of our other episodes to our Buy Me a Coffee website. Now, please consider subscribing to us there. It is completely free, and we are using that platform as a blog. So you'll see weekly posts. Actually, every 3 days we put a new post there about curiosities and trivia about the eyes and vision, as well as hot research updates on topics that did not go on to become a full episode, right? So please do consider subscribing. And again, it's free. And our mission here is making science more accessible to the population. It is free and always will be free. However, we are completely self-funded. So if you have the means to, you can certainly donate in our Buy Me a Coffee website, which, although very optional, is highly appreciated. There are also some cool tier ranks there that I just put yesterday, which you can join and contribute monthly. And if you do, you get access to stuff like special posts, episode transcripts, and other cool things, like, for instance, just suggesting themes for blog posts, short videos, or even full episodes, anything that piques your interest really about eyes and vision. So please do consider checking that out at buymeacoffee.com/eyesonresearch, or just click the link in the description of the episode. Otherwise, feel free to please share this podcast widely amongst your family and friends, and make sure to rate us if you like what you do. Rate us, not hate us. This helps us a lot as well. Thank you very much, and I'll see you in the next episode.